All right, good morning, everyone. I want to thank everybody for being here today on this beautiful day here at the Legislature. I'm Suffolk County Legislator Susan Berland, and we're here today to discuss the Know the Difference Asthma Education Campaign. Let me introduce to you who is here with us today. We're joined by our Suffolk County Executive, Steve Bellone. There you go. We have our Department of Health Services Commissioner, Dr. Gregson Pigott. We have one of the co-sponsors of the legislation, Legislator Jason Richburg. We have Legislator Rudy Sunderman. We have Legislator Sam Gonzalez. I'll clap for you. We have Melanie Gabriel, Associate Executive Director of the Huntington Breast Cancer Action Coalition. We have Michelle Ruck, nurse practitioner with Allied Physicians Group. And Dr. Monica Diamond Caravella, assistant professor and academic coordinator at the Department of Nursing from Farmingdale State College. Just to let everyone know, our presiding officer, Clarko, our deputy presiding officer, Hahn, and Legislator Kennedy, vice chair of the Health Committee and co-sponsor of this legislation, were unable to be here with us today. Their statements will be included in the press release that will be available after the press conference. Ann Little of the American Lung Association in New York and Alexander Kranides of the Asthma Coalition of Long Island were also not able to be here today. I'm going to be reading statements on their behalf of their organizations in a few minutes. So as everyone can see, this is the Know the Difference campaign poster. This is a new law that requires all stores that contain a pharmacy in Suffolk County to post the Know the Difference poster. It provides patients with vital information regarding the proper use of the medications. The poster was developed in conjunction with the Asthma Coalition of Long Island, the Allergy and Asthma Network, the New York State's Children's Environmental Health Centers, the Huntington Breast Cancer Action Coalition, and the Suffolk County Department of Health Services. It displays examples of rescue and controller medications. The poster will be available to consumers in English, Spanish, and Haitian-Creole, the three most widely spoken languages in Suffolk County. There are several types of asthma inhalers that are available to consumers, but when they're used incorrectly or are accidentally interchanged, poor outcomes may result, which include hospitalization and possibly death. The Know the Difference campaign was created to address these concerns. This campaign will serve as a tool to supplement the vital role that pharmacists play as part of the patient's healthcare team, and also the role that the doctors play. Given our current health crisis, it's more important now than ever to launch this campaign to help patients understand and control their asthma. Respiratory health is in the forefront of all of our minds right now. Approximately 50% of adults and 40% of children with asthma do not have control of their asthma, and utilizing appropriate medication at the appropriate time can significantly improve their condition. In creating this campaign, we acknowledge the central role that the county has played in improving public health. Suffolk County's long been a pioneer in effecting monumental change that later leads to regional and even nationwide change. It's what we've done time and again here in Suffolk County, and it's what we're doing now in the Know the Difference Asthma campaign. As you can see, these two inhalers, they look pretty similar. One is an emergency inhaler, and one is a regular inhaler. Now, if you're in an emergency situation and you can't breathe, you're going to reach for the wrong one. So this campaign is going to help educate you. It's going to help you determine which one is your regular one and which one is your rescue inhaler. A lot of people, it might be the first time that they're using inhalers. So a campaign like this to really help educate people so they could stay safe and not make mistakes going forward. So first I would like to introduce someone I'm very proud to call my friend, an incredible leader who has seen us through this COVID-19 crisis, is doing an amazing job for everybody here in Suffolk County. Our Suffolk County Executive, Steve Bellone.
I am really honored to be here today, and really just want to take a moment to say thank you to, first of all, our sponsor of this important legislation, Legislator Susan Berland, who is a friend and a colleague who has done an amazing job here. And before I say a few words on the legislation, thanks to all of my colleagues. She mentioned getting through this crisis that we're in, and we're still in the midst of grappling with. We are, as I characterized earlier this morning, it's almost a feeling of being in the eye of the storm right now for us, because we've been through the hurricane. We were the epicenter. We were at the heart of this in our nation, and our numbers, because of the incredible work of healthcare professionals, and I have to say thank you to all of the health professionals here for what you do and what you've done, including our Health Commissioner, Dr. Pigott. Thank you, who, as he mentioned, was on the phone earlier this morning with him, as I have been for months now. But we've come through that, but we're seeing all around the country this storm raging. And we know that we're headed just weeks from now to potentially reopening our schools and getting people back indoors again. And so our numbers are very good. We're in a good place right now, but we are, in a sense, in that eye of the storm right now. And our job is doing everything we can to make sure that we are in the best position possible as we move to the fall. And the work that we've done and the progress that we've made would not have been possible, literally, without the partnership and the leadership of the legislators here, my colleagues on the legislature, and I cannot thank them enough. We, during the heart of this for months, were on the phone every single day talking through this pandemic and what was going on. And this legislation, why this legislation is important, and first of all, it's actually good to just see my colleagues in person for the first time in a while. We've been seeing each other on Zoom for a long, long time. So it's nice. Obviously, it's a little different. We're all wearing masks and everything, but this is our new normal right now as we fight through this unprecedented natural disaster. And we do what we need to do to protect all of us. But this legislation is so important because, as Susan mentioned, this is all about respiratory illness. And we went through an event where we were looking at our hospital system potentially being overwhelmed by emergency department visits. Legislator Sunderman, who's a first responder, obviously I know has dealt with asthma issues, but we were putting protocols in place. The state was putting protocols in place for emergency room visits that would have been unimaginable to us just months ago. So anything we can do to help reduce emergency room visits, to help keep people out of the hospitals, because we're keeping them healthy by preventing things from happening, like mistakenly using the wrong asthma medication. That is a really important thing to do right now. It's incredibly timely. I think all of us know people who are impacted by asthma. We know friends, family members. This is a deadly serious issue, health issue. And I cannot thank Susan, Legislator Berland, and all my colleagues enough for putting forward this legislation, passing it, and I'm proud to sign it into law and to support it. Thank you very much.
Department of Health Services Commissioner, Dr. Gregson Pigott.
Thank you all so much for this opportunity. Thank you, Legislator Berland. This is a great idea. Any kind of education regarding asthma is extremely important. It's one of the more frustrating diseases to treat, especially when you have to deal with medications that you'd have to take on a regular basis, what we call controller medications, such as inhaled steroids, and then you have the ones that are for emergency situations or as needed. And there's always a lot of confusion between those two and a lot of education that needs to go on. And then sometimes you're repeating yourself and trying to get people to understand the difference between the two types of medications. But so visuals like these are really important, and especially at the point of dispensing of the medication. And so we're really grateful to be supporting this legislation, and I think it will make a difference in the lives of our asthma sufferers in Suffolk County. Thank you.
American Lung Association says, knowing the difference between your rescue medication and your controller medication is an important factor in being able to manage asthma, and that knowledge can be life-saving. We applaud Legislator Berland and the Suffolk County Legislature for their leadership on this campaign. In fact, as a direct result of this campaign, we've received multiple requests to expand our reach to other areas in the state, and even to adapt the poster for use with school nurses. And now let me introduce to you Melanie Gabriel, the Associate Executive Director of the Huntington Breast Cancer Action Coalition.
Hi everyone, I'm speaking today on behalf of my colleague and friend Karen Joy Miller, the founder of the Huntington Breast Cancer Coalition. She states, Long Island once again leads by example, trusting that when the consumer is provided with science-based information at many venues in a creative and tailored way, we become engaged. We tend to remember. We gain confidence when we are making critical health decisions. We have already received requests from other municipalities to share these educational posters. Thank you, Legislator Berland and all of the progressive leaders who believe in educating the consumer.
We've worked for years with Huntington Breast Cancer Action Coalition, and you know their main campaign that prevention is the cure, you know, and this just follows suit. And I really want to thank Karen Miller for all her work, and Melanie, for you too. Thank you so much for being here. Legislator Richburg, one of our co-sponsors of the legislation.
So I want to thank my colleagues. Thank you, Legislator Berland, for bringing this together. I think Legislator Berland putting this together shows what we do best in Suffolk County. What this legislation about is not just about showing people what the best inhaler is. It's a team approach. It's about saying it, reinforcing it, and then saying again and reinforcing. And Suffolk County does best is by using a team approach. As the county executive said before, when this pandemic happened, we all were together, we all rolled up our sleeves, and we all were working together. That's what this is about. Getting schools, getting our physicians, getting our pharmacies all on the same page, singing out of the same songbook, so we can help save lives. And we can't do that if we're all not working together and we're all not using a team approach. So thank you very much, and thank you, Legislator Berland.
Yes, I want to thank Legislator Berland for putting this together. You know, coming as a first responder and also from retail pharmacy, I first thought, oh, another sign. And I called Susan and I said, oh, another sign. But, you know, as a first responder and saving somebody's life, and Susan said, you know, if you could save one life, that'll make a difference. You know, and I recently had to do CPR on an adult up the road from the firehouse, because I was at the firehouse and we had to do CPR. And being able to get there first and being able to save that person's life, and then seeing that person 3 months later and being able to stop by and talk to him when I was driving down the road from the firehouse, it's an amazing, you know, task to be able to see that person and have that conversation. So when Susan said saving one life, would that make a difference, and then showing me the poster, I was amazed to be able to support it. So it wasn't just about a post, it was really about saving another life. So thank you for working hard, Susan, and everybody coming together to make it happen. So congratulations and great job. Thank you.
Hello, everyone. I think everyone here today, our county executive, our doctor, our first responders, our legislators have said it eloquently. I just want to say that I could not believe in the beginning when Legislator Berland introduced this, and the struggle and the fight that she had to go through to get this legislation and this law through. In the beginning, when I got this and I did my studies, and now, as she has shown you, when you see this, how could anyone oppose or fight this? Is something that I could not believe. But I have to give Legislator Berland so much credit for continuing, for fighting, and never saying, I am not going to take no for an answer.
So what else is new?
Yeah, what else is new? But the thing is that this hearing Legislator Sunderman go to a house and having to save a life is so unnecessary, when to see this and the chances of a child to take the wrong medication at a time that he needs it is the difference between life and death here. So, Legislator Berland, I'm just grateful that you are a fighter, and she just didn't take no for an answer. I think, you know, I'm with you. We were all with you. I'm just happy that this is now going forward as an educational piece in every single pharmacy out there. So thank you for giving me the opportunity to speak, but this has saved lives. Thank you, Legislator Berland.
I just want to put this in a public health perspective. We have in Suffolk County communities of high needs whose children end up in the emergency room and are hospitalized unnecessarily only because they or their parents don't know the difference between their inhalers. And I think Suffolk County Legislature has the moral and legal responsibility to promote this type of legislation, to have access to health education like this at every point of care. And you may not know, but the National Clinical Practice Guidelines for Asthma Control includes as one of the 4 pillars asthma education. So I applaud the Suffolk County Legislator for doing their moral and their legal responsibility in ensuring that children are safe in Suffolk County.
Hi, I actually take care of patients with asthma, lots of them. And I can assure you that I am totally in support of this legislation, and yet I'm not a big regulation fan at all, so that's very unusual for me. But I support it because this is the big ask. You see the size of that poster? That's not what we're asking for. We asked for this. And this is what will be available in all pharmacies. So it's super easy. This is very confusing. Literally 1 hour before I got on the phone with all the legislators to ask them to pass this, I had taken care of an 11-year-old girl who had spent multiple episodes in the emergency room and was completely confused about her medicine, was taking too much of the wrong one, and was harming herself. Literally 1 hour before I begged everyone to please pass this legislation, this girl was this close to going back to the emergency room again. But because I use this tool myself personally every day that I work, I said, show me what you're taking, point, because she didn't know, nor did her mother know. She didn't know how to use it. She didn't know she needed to use a spacer. And she therefore was able to tell me her history in literally 5 minutes. I was able to figure it out without waiting for the record from the emergency room for 2 days, without having to call the other emergency room, without having to call the 3 pharmacies that she uses. I had it all figured out in 5 minutes because of this poster. That's why I'm in support of this. I take care of children and young adults with asthma every single day. Thank you so much, all of you, for making this happen.
Thank you.
One more statement from the, on behalf of Alexandra Kranides, the director of the Asthma Coalition of Long Island. Asthma self-management education provides an opportunity to empower people with asthma to live full and active lives. Reaching families at the pharmacy counter is a natural place for this education to take place. We look forward to working with pharmacists and their team to make the most of this impactful policy. We at the Asthma Coalition of Long Island look forward to continuing our work with the Suffolk County Legislature and all of Long Island to connect our community in support of every child with asthma. All right, well, maybe we'll take a nice picture around the poster, and I want to thank everybody for being here. Thank you.